Hi, I'm Dr. Sarosh Rana. I'm a maternal fetal medicine specialist in OBGYN at the University of Nebraska Medicine. I'm also the chair for the Department of OBGYN. I actually grew up in India, and in general, there are only two careers that a woman can choose there way back in the 1970s. Either you can become a teacher or a doctor. So I did my medical training in India, and then later on, I am really very obsessed with improving maternal health and just in general women's health. So that is a big reason that why I'm in medicine. I also trained at University of Chicago and then did my fellowship at Brown and actually took my first job in Boston. I did my research there. So I take care of high-risk moms, so moms who have problems during their pregnancy and also babies who have problems. But I personally am very interested in, and most of my research and clinical work is based around hypertension in pregnancy. So in my clinic, I take care of patients who have high blood pressures, who have chronic kidney disease, transplants, lupus, antiphospholipid, anything that predisposes you. Also patients with a prior history of preeclampsia. Most of my work in my lab, in my clinical research is around preeclampsia, which is a hypertensive disorder of pregnancy. So one of the big advantages of staying in academia is that I do a lot of translational research. So I've been part of developing some of these biomarkers, which have been now FDA approved for prediction of outcomes in women with hypertension. So being in academia is really helpful because you can take some discoveries that we had, for example, in the lab and take them to bedside. And similarly, you can take things that you do at bedside back to the bench and say how you can improve outcomes. So that's one of the main reasons I stay in academia. So when I was actually training in India, a lot of, and it's still true actually, I trained in the northern part of India, they have a very high rate of maternal death. So death happens from a variety of reasons, and as in general, I was like, oh my God, like we need to help these women. And I would say it's still true even in the United States. The rates of maternal mortality are going up. There's lots of racial disparity. So one of the reasons for me to go into medicine and do maternal health and women's health is because of the large gap in improvement that we can actually do.